Good morning, everyone, and welcome to Urban Update. I'm Byron Barnett. On the show this morning, Motown the Musical, still playing at the Boston Opera House, and today we get a special visit from none other than Smokey Robinson. You'll meet the actor who plays the legend in the musical. Also on the show, an online business of delectable desires opens its first brick and mortar shop. We'll meet this local female entrepreneur and we'll get to know her success story. But up first, the crucial deadline to sign up for health insurance coverage is next Sunday, February 15th. Applying and actually choosing a plan is not the easiest of tasks, especially for those needing help paying for coverage through MassHealth or the Health Connector. Our first guest has been doing his best in spreading public awareness around the importance of this deadline through various events across the Commonwealth. To bring us up to date with that, in what can be considered an important and final stretch, is Jay Gonzalez, President and CEO of Celticare Health, which offers health insurance plans through MassHealth and the Health Connector. Welcome to Urban Update, Jay. Thanks for coming in.
Thanks for having me.
So let's give our viewers a few more details on the importance of next Sunday's deadline. Why is it important for folks to enroll by next Sunday?
Because it's the last chance this year to enroll for health coverage. So if somebody doesn't currently have health coverage, if they don't sign up through the connector by February 15th, only 1 week away at this point, then they won't have another opportunity for the rest of the year. So it's really important to get that security that they know they're going to have health coverage and they're going to be able to see their doctor or go to the hospital if they need to. And also so they don't pay a tax penalty, because under the new law, if somebody doesn't have health insurance coverage over the course of the year, then they have to pay a penalty, because everybody has to have health coverage now.
No, what has Celticare, your company, been doing to make sure that people know about the deadline?
So Celticare has been trying to partner with the Connector, which has been holding open enrollment events around the state to make sure people know that they have to sign up for coverage, and to help people do so, because they still have to go on the website. It's a process that can be long, and so we want to make sure that people have help. So Celticare has been holding its own enrollment events around the state. We held 4, including in Worcester, and a couple in Boston, one in Lawrence, a great event in Lawrence. We tried to hold one in Springfield and Brockton, but the snow forced us to cancel. But over a couple hundred people have showed up. Great turnout, and clearly lots of interest from people who know they need to sign up and need help. So the great folks who I get to work with at Celticare have been sitting down with people who've been coming to these events and literally walking them through the enrollment process online.
Now, speaking of the process, I guess talk to me about the process of enrolling and how it all works.
So people go on the Connector's website, and they can do so in paper also, and they apply for coverage. The Connector then figures out what program they're eligible for. A lot of people are eligible for help from the government in helping to pay for their coverage, whether they're in the Medicaid program, MassHealth, or even if they get coverage through the Connector. So the first step is figuring out what program they're eligible for. And so far, 427,000 people have gone through that process and been determined eligible for coverage. The problem and the concern is that of those people, there's still over 100,000 who have not done the second stage of the process, which is picked a health plan for coverage. And there's only a week left, so that's a lot of people in the course of a week that we need to get the word out to make sure they take that final step and get the coverage they need.
Now, what do you think people should know about all of this that you find they don't?
Well, I think one thing people should know that I'm not sure everybody does is they have a choice of a bunch of great health plans in Massachusetts. We're lucky here that there are a lot of great plans. I personally am a little biased and think our plan at Celticare is the best, and we offer the best services to our members, which I'm hoping you'll let me talk about in a minute. The other thing is that I'm not sure everybody realizes that they're able to get help from government in paying for the coverage. So even if they aren't in Medicaid, they can get subsidies from the government, which will make the amount that they need to pay for their premiums relatively low, depending on what their income level is. So it's really important for people not only to get coverage, but to understand that they're going to be able to get affordable coverage.
Well, here's your chance to talk to me about Celticare Health plans and what you offer.
Well, thank you. So we offer a wide range of benefits like most other health plans, the typical services that people need, healthcare coverage people need. And we also have a great network of doctors and hospitals all throughout the state that people can go to, a lot of choices in that regard. But I think what distinguishes us is we've got a number of different innovative approaches to trying to keep people healthy and to help people who are sick. So we've got nurses on staff who will work with individuals who we cover. If they've got chronic healthcare conditions, we will work with them to make sure that they've got access to the right healthcare, that they're doing all the stuff they need to do, taking their medications, the preventative healthcare stuff that they need to do to stay healthy. We also have social workers who will go out into the community, literally to people's homes, to find them if we haven't been able to contact them, make sure that they know they've got access to health coverage. If they need help making a doctor's appointment or anything like that, we have people on our staff who will go to their home and personally help them do that. And we've got a number of other benefits like a debit card that we give each of our members, and if they do things to keep themselves healthy, like go to their annual doctor's visit, then they'll get cash that we'll give them on their debit card that they can use to buy groceries or stuff at the drugstore. So I think we're pretty unique in that regard.
That debit card, that sounds, that's very interesting. Just a sort of a wellness
That's
reward?
Right.
Or,
That's
I mean,
right.
I mean, giving people cash for going to their doctor's visits, is that cost effective?
Well, you may think for a health insurance company, why are we spending money on that? But as you said, they're really to pay for wellness. We're helping people, encourage people to do things that at the end of the day are going to keep them healthier, which is better for them and ends up saving us money. So it's the nice thing about healthcare, and one of the reasons I love it, is that if we do a really good job at Celticare of keeping our members healthy, we actually save money for ourselves and for our state customer, and that's what it's all about.
Now, we've done a number of shows that have tackled the issue of health disparities in Massachusetts, especially in the Latino community. How do you view the role of the healthcare industry in tackling these types of issues?
I think it's really important. And you know, what's interesting is Massachusetts was the first state in the country to pass health reform, and it was the model for national health reform. And that happened in 2006. After we implemented that program in Massachusetts, the disparities in coverage started to narrow. So the Latino community, the African American community, a lot of other minority groups, you started to see them get more coverage, more doctor's visits, healthier than they used to be. So through Massachusetts health reform, and because more people have coverage, we've started to close that disparity gap, but it still exists, and it's really important, I think, for us leaders in the healthcare industry to do everything we can to reach out to them. So Celticare, for example, in addition to holding these enrollment events that I was talking about in communities like Lawrence, where there are big Hispanic populations, we also do a lot of advertising in ethnic media to make sure we're reaching this population through the media that they take in, and I think it's incumbent on us to make sure we're doing everything we can to provide coverage to them.
Talk to me about the profile of your customer.
So our customers tend to be low income. We really focus on trying to provide supports for low income customers who are getting health insurance coverage through state subsidized programs like Medicaid or through the connector. So they tend to be low income. Many of them will be working, but just not making enough to afford coverage. Maybe working in a restaurant or another low-wage job. We also have a lot of people who are long-term unemployed, people with substance abuse issues, which I know is a big issue throughout the state right now. So we've got a lot of programs that are targeted to try to help people with those types of conditions. And
before we finish, could you just give us a little overview on who you are and how you arrived here in Boston?
Well, I'm Jay Gonzalez. I'm originally from Cleveland, Ohio, but I ended up here because I went to college in New Hampshire and got to know Boston and loved Boston. So I moved here in 1998, and it's one of the best life decisions I ever made. This is a great community. Massachusetts is a great state. A lot of people who care deeply about making this a great place to live, and I'm glad to be a part of this community.
The number one thing people should remember back to the signing up for health care is what? The deadline's coming up?
1 week away. If you don't have your coverage yet, you've got 1 week to make it happen. If you need help, go to our website, SelticcareHealthPlan.com.
Okay, Jay Gonzalez, thanks for coming in, and thanks for enlightening us on this very important issue.
Thank you for the opportunity.
Okay, when we return, Motown the Musical is now playing in Boston. And when we come back, we'll give you an exclusive chat with a member of its cast right here on Urban Update. We'll be right back.